A warm welcome to all our viewers to our series Natural Medicine Today. Today we're talking to an internist and environmental medicine specialist about the possibilities of toxophoresis to really free people from environmental pollution and, of course, secondary illnesses and pain, and to regulate discomfort in the body or, if necessary, to bring about recovery.
Folgeerkrankungen und Schmerzen und Missempfindungen im Körper zu regulieren oder gegebenenfalls auch zur Genesung zu bringen.
And I am very pleased that today Dr. Med Harald Burgard is here, and stay tuned.
Bleiben Sie dran.
Hello, dear Harald. Glad you're here today.
Hello, many thanks. Good morning.
And hello, Mr. Pietsch. Thank you for joining our show today.
Yes, thank you very much. Greetings.
Hello. I would also start straight away with our guest. He has a certain amount of suffering, I would say, but also a nice success story. And I'm very pleased that you took the time today to really show our viewers a way. Of course, there are also a lot of stones that often get in the way and that you have to jump over or go around. And of course, I'm very happy about your story, Mr. Pietsch.
Yes, Miss Klein, thank you very much. I am happy to make a contribution. From my youth, my main problem was my heart. For some reason, I have no idea why, I suddenly developed incredibly severe cardiac arrhythmias without any motivation. And I took the classic route, went from cardiologist to cardiologist, had to go to intensive care units and God knows what. I've also had a strong medication treatment. And under a high dosage of medication. I could then suppress these cardiac arrhythmias. I thought to myself, things can't go on like this, and then contacted a homeopath. And then he helped me through detoxification measures. And as a result, after a long time, these arrhythmias have almost disappeared. They are still there every now and then, but now they are gone. That was between the ages of 20 and 30. As a result, I had already found the way to alternative medicine and was thrilled. And to classical medicine, with all the advantages it offers. I was then a bit more distant. Then I progressed through my professional career. It was a bit stressful at times, and then a blood pressure problem set in, which was then treated classically by doctors with medications that lower blood pressure. And after that it also happened, but you always have that when you go to a traditional doctor, they only focus on what is currently happening in the body. So if you have a blood pressure problem, you get blood pressure medication. If, what do I know, your leg hurts, you get painkillers. But you don't have a general overview there. And then it turned out through 1 or 2 abnormal sensations in the heart, accompanied by pain, that I had a strong deposit in my heart. Fortunately, this was recognized in time. And then I had 2 stents put in to restore blood flow. And at the same time, this blood pressure situation continued. And then I always took my tablets, always in a higher dosage, and thought, damn it, I hope you can keep this up for a while. And then, independent of this cardiovascular event, at once I got problems in the knees. Arthrosis, problems in my knees, that was about 2 or 3 years ago. I then had surgery on one knee. That was also successful. And shortly afterwards I started having problems in my other knee. Then I thought, well, that one hasn't healed properly yet. If you have the second one operated on now, there may be problems. And then I looked around on the internet to see if there were any other methods. And by chance, I came across Dr. Burgard and saw a friend there who I know from my work. And then I called the lady. Doctor, Burgard has this, I always say, my gold knee, this procedure where some gold elements are used to suppress the pain. And she sang the praises of Dr. Burgard. Well, and then I introduced myself to Dr. Burgard. Good, but as I said, that was only because of the knee. Then Dr. Burgard said, yes, we can do it. Then I underwent one of the treatments and it was very successful. Accompanied by various physiotherapeutic measures, which I now do regularly, it has virtually healed. So really highly recommended. And then I came to the practice and suddenly I saw a sign. Apheresis, what is that? I've never heard of it before. And then I asked, well, this is a process to remove poisons or substances from the blood that don't belong there. Such troublemakers. And then I made an appointment with Dr. Burgard and then told him my story, roughly like I'm doing here now. Yes, and then Dr. Burgard unpacked his instruments and first had a complete blood test carried out and then saw what was actually going on with this Mr. Pietsch. And that's what I just said. There is a big difference between treatment by a traditional doctor and the method like Dr. Burgard runs it so that you have a comprehensive overview of people, about the health of the person you have in front of you. And that is the big advantage of this procedure. And then I said that I have this blood pressure problem, I've had a nerve disorder in both legs and in my lower legs for a year or two, this is called polyneuropathy, and then I have other clinical pictures that, according to Dr. Burgard, fit into this treatment for apheresis.
Das nennt sich Polyneuropathie und habe noch so andere Krankheitsbilder, die so nach Aussage von Herrn Dr. Burgard in diese Behandlung für eine Apherese passen.
Then the treatment with apheresis was prepared and various other measures were taken in Dr. Burgard's practice. And then the apheresis treatments came. I have now, I think, 8 under my belt, 8 or 7, 8 apheresis sessions under my belt. And now since the second last one I have suddenly felt an improvement in my blood pressure. So I only have to take a tenth of the tablets. Completely without didn't really work, I'm still taking a basic dosage. And with this nerve problem in my leg, that has also improved significantly. It's not gone yet, but it has improved significantly. So complete success. I'm glad I took the step. And well, it was more or less coincidence that I ended up there. That's my story.
Super exciting. Now about the restrictions in life when it comes to the feeling of pain and all the blood pressure and medication. How much would you say has your quality of life improved?
Yes, clearly. I mean, I'm turning 70 now. I still exercise, of course, within the appropriate framework. I'm not tired during the day. I have colleagues who are always tired and exhausted. So this is really a good method to significantly increase the quality of life. We can only recommend this, really. And I saw it in myself. I didn't know, apheresis. Well, what is that? Never heard. And I think programs like this, how you do them now, they are incredibly important in bringing this process to people.
Die sind unheimlich wichtig, dieses Verfahren an die Leute zu bringen.
This is really, really important.
Wichtig, ne?
Yes, it also takes people like you who have the courage to take these paths and talk about them. So from our side, thank you for giving the audience the opportunity.
Ja.
It is also said that apheresis, because it combines so many toxins in the body, we have already heard that you felt much better during the day and also fitter. Did it also have an influence on concentration and performance? Because it is often said that dementia and lack of concentration also come from heavy metals afterwards, where you can then feel a significant improvement.
Yes, well, I'll say I'm still wide awake. At least that's what I imagine. So I didn't really feel the improvement because I didn't have any restrictions.
Die Verbesserung gespürt, weil ich da auch keine Einschränkung hatte.
So my limitations were the blood pressure situation and the thing with my leg, so these nerve problems. That has improved significantly.
Also mit diesem Nervenproblem. Und das hat sich deutlich gebessert.
Overall, you are of course more awake.
Gell, ich
But I will say that it wasn't such an issue for me that I was somehow mentally impaired or anything else.
irgendwie geistig eingeschränkt wäre oder sonst was.
Everything was actually still intact.
It wasn't meant that way. I thought more in terms of concentration. We all know a little bit about that. Great story.
Yes, we are talking about a nerve sensation problem here which is called polyneuropathy. This is something that we know from academic medicine to be very, very difficult to treat. This mostly affects diabetics. That's not you, Mr. Pietsch. In his case, this nervous disorder was more likely due to toxic events. This means a mix of environmental toxins such as pesticides, insect repellents, formaldehyde, but also toxic metals, how typically aluminum or mercury can do that. And if you reduce these things, and procedures like pathopheresis or toxophoresis can do that, so procedures that are able to wash environmental toxins out of the body. And if you use these procedures and, as happened with him, remove these toxins, then inflammation goes down, healing processes begin, and microcirculation improves. And that then leads to the nervous system recovering, but also, as we have seen here, through the reduction of inflammation, through the reduction of the stress axis, which form too much cortisone or other vascular constricting substances and so on, which also causes blood pressure to go down. And this is often the case, and we have just heard it again from him, that blood pressure goes down and that you have to adjust your medication accordingly, but that also some long-standing nerve pain also disappears. And Mr. Pietsch also had the gold implantation. We also heard that it works and that it. Are you pain-free in your knee, Mr. Pietsch, or how much better?
Almost. So of course I can't do a 100-meter sprint now, but if I exercise normally with walks and a certain amount of rehab sport, which is then also applied in doses, I'm almost pain-free.
Und in so einen gewissen Reha-Sport, der dann auch dosiert angewandt wird, bin ich so gut wie schmerzfrei.
Every now and then it still pinches, but nothing compared to before. So that's a great method too, really.
But you are also an interesting example because you first went the conventional route with the knee procedure, with the operation, and then really on the other side used gold implantation as a solution. Now, of course, you are the best person to ask, what was the more relaxed way or the way that made more sense for you?
Well, let's say the more relaxed way is of course the solution that Dr. Burgard offers.
Natürlich die Lösung, die Dr. Burgard anbietet.
The other is an intervention, an operation. I had to deal with the consequences of the operation for a year. But that is also stable now. I have no problems now. Of course, the patients are responsible for themselves. If I just sit here and conduct interviews with you all the time, then the knee that was operated on will become stiff again. But you have to do something about it yourself. Luckily, I found a facility that offers physiotherapy. There are a lot of people who have their equipment standing around, but they also have a crew, a sufficient number of therapists, that observe you constantly.
unter deren Beobachtung man permanent steht.
And then you are instructed to do what is good for your knees.
Zu machen, was für Knie gut ist.
I still have 1 or 2 problems in my back. This will then also be taken care of. And that's a well-rounded thing. You just have to go there once or twice every week. This is incredibly important.
Was the clinical picture in the knees on the right and left the same?
Excuse me?
The clinical picture in the knees, was that the same?
Yes, it was the same on the right and left. And the right knee that Dr. Burgard has treated, that is also stable. But as I said, you have to do something constantly. But then there is peace. I'm glad such methods exist. Both the topic of Dr. Burgard, as well as the other, the operational measure. But of course, I just came in the direction of Dr. Burgard because the right knee gave out immediately after the operation. And I didn't want to do that again. And so, fortunately, I came to see Dr. Burgard.
Do you have another important question for your patient?
Not a question, but as Mr. Pietsch rightly said, it is of course always important that people, if they have a knee problem, for example, and it gets better with gold implantation, of course, you also move your knee again, that you simply build up your muscles, you strengthen your entire support system, and you do physical therapy. The stronger the muscular system, the longer people can walk, even in old age. And that's why we generally recommend, even if capsule patterns are already there, that is, if mobility is restricted because it has already taken so long, afterwards through physiotherapy exercises, muscle building, and so on to normalize the whole thing again. This is also possible when you are pain-free afterwards. Then it will be even better. And if the muscles are strong, people can move well for a long time.
Sure, and building muscle and performance obviously requires a body that is efficient and detoxified. Of course, that's the combination again. I would like to go over the results of the detoxification again. If I did such a toxophoresis, how does something like that work? How can I imagine that?
Well, first of all you lie in a bed, as he experienced it. So in a special treatment bed. You are connected to both sides, like on a drip, right and left. If people have very bad veins, which rarely happens, but it does happen, then we just use a central venous access via the groin. That's not a big deal either. And then the blood is taken out on one side and runs into a machine. There the red blood cells or the blood cells at all are separated from the liquid portion of the blood. And the poisons and so on are in the liquid part. And this liquid part is first warmed up to around 43 degrees, which weakens or partially kills pathogens and partially cracks heat-sensitive poisons. Then the blood runs into a filter, which is specifically designed to remove environmental toxins, but also inflammatory messengers, circulating immune complexes that cause inflammation that can trigger autoimmune diseases. And much more, partly viruses, partly poisons from fungi and so on. This is being pulled out. And then the purified blood runs back into the body with the separated part of the corpuscles, the solid components. And this is a procedure runs for 1.5 to 2.5 hours depending on the person, depending on their body size and blood volume and so on. It is generally tolerated extremely well. Sometimes you can feel a slight of swelling under the eyelids afterwards. Or that your fingers or feet are a little swollen. This takes a few hours, then it goes away again. But otherwise there are no complications. It is very well tolerated. We also often have quite old people or very sick people, and they also tolerate it well. And the effect is that you gradually pull out the toxins with several treatments. Then something runs out of the cells, then you pull it out again. This continues until the amount of toxins was reduced to such an extent that your body and your tolerance threshold fell below it. And then the symptoms go away slowly or, as he said, suddenly noticeably. And persistently too.
Well, it's important. I've also now had the experience that when people have had amalgam for years, it's really like a degradation process. That you always have to readjust. Do you have the feeling that the first result, you always send in the results? Are they the most concentrated ones? Or is it more like the second or third run when the body releases a real surge?
richtigen Schwall abgibt.
Yes, we've seen it for years. I've also been doing a lot of chelation therapy for years, and you can see it the same way. It's always the case when you detoxify someone that not much comes out at the beginning. And then, when the process of deacidification, detoxification, and so on is started, suddenly deposits appear and you suddenly have very high levels of excretion. Then sometimes you suddenly have triple-digit amounts of toxins in the analysis. Or visually, you can also see what it looks like in the eluate when you pull it out. So sometimes, as I said, a lot more comes out or less comes out the second time. But much more the third time. The body regulates this, depending on which deposit you can currently access, depending on what you have done, depending on how the detoxification is ramped up. But something always comes out and sometimes more or less. What is crucial is that these things are reduced and that little by little you get below your tolerance threshold. And then the spook stops.
What I think is great about you is that you have years of experience with dialysis patients. So you are already very familiar with this procedure. And I find it very exciting that filter systems like this have been around for a long time. And of course there are also critics who say, how can you filter out poison in such a differentiated way? Aren't minerals also discharged? Because then there is a bit of worry. Is it so mature that I can really let my whole body be flushed through it?
Well, first of all, you have different filter systems. The classic apheresis that we know is there to reduce fats. That's what cardiologists do when someone has very high LDL cholesterol, very high lipoprotein A, or very high triglycerides. You then take them out using this special procedure. But that doesn't mean you get to the environmental toxins. We just have membranes that are structured in such a way that they remove environmental toxins and circulating immune complexes and so on. They simply have a different structure, they have a different pore size and so on. And then of course there are other filters that can be used to bind pathogens and whatever. So there are a whole variety of filters that are available today for special areas of application. But when we talk about environmental loads, which is what we did with Mr. Pietsch, you just use the filter that works for environmental toxins and it is able to get out exactly what I just said. Of course there are also a few minerals that come out, which is not much. Because I always carry out laboratory analyses on every patient, often at my own expense, I tested it afterwards to see what electrolytes were in the eluate and so on. And then you see, that is very little. But of course, like with chelation therapy, you go and then give people these things for the time in between. This means that they get a preparation that contains minerals, vitamins, and so on so that there is no deficiency. Of course, we always check the blood, what is the mineral supply, what is the vitamin supply, and correct deficiencies beforehand or during the therapy. You just have to do it, it's part of it. It's like driving a car without oil.
Well, Mr. Pietsch, I hear you're in the best of hands.
That's right. And perhaps, if I can make another comment, in my case I was now fully treated with regard to the blood pressure situation and this polyneuropathy from a classical medical perspective. That's where you get your pills. With polyneuropathy you have to wait and see what happens, there's nothing you can do. And now this procedure from Dr. Burgard, this is moving towards healing. This is something that cannot be pointed out often enough. The cause is combated, just like Dr. Burgard always says that. So it's not just a pill that's prescribed, but it's checked based on blood tests. Pietsch, what's wrong with you? And we have such and such instruments in practice. It's not just apheresis, there are other treatment methods, complementary treatment methods. And that's something that really needs to be pointed out. And I would be grateful for that too. I mean, these therapies or these treatments also come at a price and are not open to all sections of the population. So if something were to happen in terms of health insurance companies, people would also accept these treatment methods. So that would also be thought of in a social direction if something like that could be implemented.
Absolutely, yes.
Yes, absolutely. I would like to thank you very much for your time and for giving us so much insight, including into your private situation. And yes, it certainly has helped many people. Thank you very much.
Okay, thank you too. And also, I already said that I think it's really great that you are looking for a way to publish such findings and also help to carry this method forward.
Yes, dear Harold.
Yes, thank you very much, Mr. Pietsch.
Okay.
If one or the other says, "Oh, that's exactly my clinical picture, how can I contact them now? How do I access these procedures now?"
Interested people can go to our website, drburgard.de. You can read about it there. You can find films that also provide information, and then just get in touch via email. It's best to email us because our phones are already very busy.
Well, great. Thank you for doing such a great job.
Thank you for the interview.
See you soon.
See you soon. Thank you very much.
Dear viewers, it's always wonderful that we have guests who find individual solutions, especially for individual illnesses. And it's even nicer that we can take it to the outside world. Thank you for watching. Wonderful time and see you soon. Bye.